Hi, I'm Dr. Chin Nokura. I'm a consultant paediatrician. Thank you so much for all your questions. I'm sorry we're not going to be able to get through all of them, but we'll do as many as we can. Hi, how long does a cough have to go on for to be concerned about? My little boy always seems to be coughing to some degree. In the past, I've been told it's just one virus after another. Is this true? So I've got a 2-year-old and a 5-year-old, and I can tell you that children that age cough all the time. There's a nice study that shows that 10-year-olds will cough 11 times over a 24-hour period, even when they're well. We also know that young children will have between 6 and 12 colds a year, and that they'll cough for between 1 and 3 weeks after every cold. With that in mind, you'd be forgiven for thinking that they never, ever stopped coughing. Thankfully, as they get older, things get better. And what really I think you're asking me is, when should you be worried? So the first thing to say is that most coughs are normal. Most coughs get better on their own, and most don't mean anything in particular. Things that should really cause you to ask the question of your GP or your paediatrician would be things like a cough that's associated with your child not gaining weight or having oily poos all the time. A cough that's particularly bad at night and lasts all year round, even when your child doesn't have a cold. Or a cough that's associated with severe chest infections that take a long time to get better. Or perhaps a runny nose that is always there, perhaps from the day your child was born. If any of those things are there, then I would seek medical advice. So I have a couple of questions around chickenpox vaccine. The first one is the chickenpox vaccine worthwhile? I'm considering getting it for my daughter soon. She's 2 in April. No underlying conditions? And also, is it safe to give your child when you are pregnant? I know it's a live vaccine. The second question asks whether a blood test could show whether my children have had chickenpox, as I don't think I've seen them with symptoms. We don't recommend chickenpox vaccination in the UK. Why? Because if you get chickenpox as a child, it's usually a relatively minor illness, and actually the immunity that you get from that is lifelong, as opposed to if you would receive the vaccination, where the immunity can wane within a few years, and then you put yourself at risk of getting a severe adult form of chickenpox, which can be really quite nasty. The downsides, I guess, of having chickenpox as opposed to the vaccination is that you may leave yourself open to developing shingles in later life. But on balance, the UK recommendations are in favour of not vaccinating. And that's what I would recommend. So the notable exception to this advice is if you're thinking of starting a family and you're not sure that you've had chickenpox. It's simple enough to get a blood test from your GP that will show whether you have chickenpox immunity, in which case you have nothing to worry about. However, if you find that you aren't immune, it's important that you get vaccinated before you start trying for a baby. But if you find that you can't get vaccinated because you're already pregnant and you are exposed to chickenpox, it's important that you see your GP urgently to see if you can get a special vaccination called VZIG, which will protect your unborn baby. There are 2 questions on ADHD, attention deficit hyperactivity disorder. That's the last time I'm saying that in this question. One from a parent who wants to know at what age roughly do we think it's appropriate and helpful to seek an ADHD diagnosis? And the second is, how is it diagnosed? Is it done by a paediatrician or is it by a multidisciplinary team? I guess the age at which you seek an ADHD diagnosis depends on the age at which your child shows signs or symptoms that make you worry about it. If you're not worried, then you'd never do it. We're looking for a child where those behaviours, which can be normal, are occurring at a level, at a frequency, in a context, in a way that means that they are causing significant problems for you and your child. There are a range of professionals that are involved, be they child psychiatrists, paediatricians, or other specialists specifically trained in ADHD. How is it diagnosed? Well, there are no specific tests as such. There's a series of interviews, questionnaires, and observations which occur across settings, so perhaps in school, at nursery, at home, at grounds. And what they're looking for is a pattern of difficulty paying attention, difficulty concentrating, hyperactivity, occurring in multiple settings for at least 6 months and starting before the age of 12 years. If you see all of those things, it's worth looking at a diagnosis of ADHD. That said, we do some tests, and that's where the paediatrician may come in. They may refer for hearing screening, for example, or they may see something else in your child's behaviour that makes them think there's something else going on, and therefore tests would be performed to rule medical causes out. What are normal milestones for the first couple of years? Every website says something different. There are often threads along the lines of, my X-month-old child hasn't hit this milestone yet. Should I be worried? There's a reason that every website says something different, and it's because the ranges of what's normal are massive and they vary. One child will be particularly ahead in physical activity, but maybe struggling a bit with speech. One child will be very good with fine motor activity, but doesn't communicate quite so well. It is normal to have a range and to be strong in one area or weak in another. Bringing up children is the most important thing that you'll ever do, and it's the thing you're going to worry most about getting right. It's the thing you're going to worry most about missing something. Most of us turn out fine. And if something isn't going right, it's not going to be that tiny thing that they're not ahead of on website number 3. It's going to be something bigger that you should spot, or that we will spot as part of the screening program. Is a circumcision the only option for a tight foreskin that won't retract? No ballooning, no infection? My son is 9, might things loosen up during puberty? So the short answer is there are plenty of other options. 90% of boys will have a normal foreskin by the age of 7 years, and 99% will be normal by 16. That said, therefore, the only reasons to intervene sooner would be if he was developing complications, such as ballooning of the foreskin with urine struggling to get out when he's trying to go to the toilet. If maybe he was getting infections around the foreskin, or perhaps if he had a rare condition called paraphimosis, where the foreskin becomes tight around the tip of the penis, at which point he may need surgical intervention. If none of those things are happening, actually the options are fourfold. The first, and probably that most favoured by your teenage son, would be that you leave well enough alone. And actually by the time he reaches the age of 10, 11, 12, I can pretty much assure you he'll find a reason to start loosening things up. The second is that there is some evidence for steroid creams. Short of circumcision is minor surgery just to loosen the foreskin, but leaving the foreskin intact. And actually it's only as a last resort that circumcision, where the foreskin was removed surgically under a general anaesthetic, would be an option. So those are the medical answers. Obviously, if you have cultural or social reasons for circumcision, that's an entirely different question. So I've been Jin Nokoro. Thank you for your time, thanks for listening, and thanks for all your questions. Sorry I didn't get to all of them, but we'd have been here all day. If you're interested in this sort of work, please hang around the Mumsnet forums. We're going to try and do more Q&A with medical professionals throughout the year, and maybe you'll see me back and I'll answer your question next time.